Medical Assistant Exam 100 Questions and Answers.
Question 1. At what angle is a routine venipuncture needle commonly inserted in the outpatient clinic during a competency review? Option A. About 60 to 90 degrees. Option B. About 15 to 30 degrees. Option C. Parallel under the skin for several inches. Option D. About 5 degrees for every adult. The correct answer is option B. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. A 60 to 90 degree angle is more likely to puncture through the vein. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. A very shallow angle may fail to enter the vein or may drag under the skin. Question 2. Before inserting the needle for a lipid panel, why should the selected vein be anchored? Option A. It replaces the need to cleanse the site. Option B. It allows the tourniquet to stay on longer. Option C. Anchoring stabilizes the vein and reduces rolling during entry. Option D. It sterilizes the skin. The correct answer is option C. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Skin cleansing is still required before puncture. Anchoring does not justify prolonged tourniquet time. Anchoring does not sterilize skin or remove microorganisms. Question 3. After cleansing a venipuncture site with alcohol, when should the needle be inserted in the urgent care laboratory during a study session? Option A. After blowing on the site. Option B. After wiping the area with a used gauze pad. Option C. Immediately while the alcohol is wet. Option D. After the site air dries completely. The correct answer is option D. After the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Blowing on the site contaminates the cleaned area. Used gauze can reintroduce microorganisms to the puncture site. Puncturing through wet alcohol can sting and may affect specimen quality. Question 4. How long should a tourniquet generally remain in place before it risks hemoconcentration in the pediatric clinic during a structured exam prep drill? Option A. No longer than about 1 minute. Option B. Until all labels are printed. Option C. Only after the patient pumps the fist repeatedly. Option D. At least 5 minutes for every draw. The correct answer is option A. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. Administrative delays do not justify prolonged tourniquet use. Repeated fist pumping can also contribute to hemoconcentration. 5 minutes is excessive and can distort laboratory values. Question 5. When should the tourniquet be released during routine tube collection in the long-term care unit during a clinical simulation? Option A. Before the needle ever enters the skin in every case. Option B. As soon as blood flow is established and before removing the needle, following policy. Option C. After 5 minutes to improve the specimen. Option D. Only after the patient leaves. The correct answer is option B. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Removing it before needle entry in every case may make vein access difficult. Prolonged application does not improve specimen quality. Leaving it on until the patient leaves is unsafe and unnecessary. Question 6. Why should patients avoid repeatedly pumping the fist during venipuncture in the mobile collection site during a review? Option A. It prevents all hematomas. Option B. It guarantees faster clotting in citrate tubes. Option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Option D. It sterilizes the collection site. The correct answer is option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Citrate tubes are anticoagulated and do not rely on patient fist motion. Fist pumping has no antiseptic effect on the skin. Question 7. Before proceeding with the draw, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes in the emergency department bay during a mock exam? Option A, 30 gauge needle for all adults. Option B, a lancet designed for heel stick only. Option C, 12 gauge needle. Option D, 21 or 22 gauge needle. The correct answer is option D, 21 or 22 gauge needle. A 21 or 22 gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A 30 gauge needle is too small for standard evacuated tube collection and may slow flow. A heel stick lancet is not used for routine venipuncture. A 12 gauge needle is unnecessarily large and traumatic for routine phlebotomy. Question 8. For a patient with a small fragile hand vein, which device may improve control in the physician office lab during a skills check? Option A, winged infusion set with appropriate tube or syringe technique. Option B, heel puncture lancet. Option C, unprotected straight needle used without a holder. Option D, large bore blood donation needle. The correct answer is option A, winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. Question 9. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the community health screening event during a practice drill? Option A, the discard tube removes EDTA carryover from the skin. Option B, the tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option C, the discard tube replaces patient identification. Option D, the discard tube warms the patient's arm. The correct answer is option B. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. A discard tube is not used to warm the arm. Question 10. If no blood enters the tube after needle insertion, which action is safest first in the preoperative testing area during a scenario? Option A, turn the needle in circles under the skin. Option B, leave the needle in place while searching for another vein. Option C, gently adjust needle position while staying within policy and patient comfort limits. Option D, probe deeply until blood appears. The correct answer is option C. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Question 11. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the Oncology Infusion Center during a competency review? Option A, ask the patient to ignore it until the tube fills. Option B, release pressure only after all tubes are collected. Option C, advance deeper to pass the nerve. Option D, stop the draw, remove the needle safely, and follow facility procedure. The correct answer is option D. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Question 12. During a difficult draw, why should excessive probing be avoided in the dialysis-adjacent clinic during a final review? Option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Option B. It sterilizes the vein. Option C. It prevents the need for patient identification. Option D. It improves all specimen results. The correct answer is option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Question 13. If a vein collapses during evacuated tube collection, which change may help on a redraw in the student skills lab during a study session? Option A. Keep the tourniquet on for several minutes. Option B. Use a smaller tube, syringe, or winged set according to policy. Option C. Tell the patient to pump the fist continuously. Option D. Use a stronger vacuum tube on the same fragile vein. The correct answer is option B. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Question 14. In a routine phlebotomy scenario, which site should generally be avoided unless specifically approved by policy or provider order in the occupational health clinic during a structured exam prep drill? Option A. An acceptable dorsal hand vein. Option B. A suitable cephalic vein. Option C. A foot or ankle vein. Option D. A well-palpated median cubital vein. The correct answer is option C. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. Question 15. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the blood collection station during a clinical simulation? Option A. All tubes drawn from that arm turn blue. Option B. It eliminates the need for a tourniquet. Option C. The blood in that arm has no cells. Option D. The fistula must be protected from injury, infection, and altered blood flow. The correct answer is option D. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Question 16. Why is the site of a prior mastectomy often avoided for venipuncture in the outpatient clinic during a review? Option A. Lymphatic changes can increase risk for swelling, infection, or complications. Option B. The skin cannot be cleaned. Option C. All specimens from that side clot immediately. Option D. The veins always contain arterial blood. The correct answer is option A. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. Question 17. When N4 is running in one arm, which collection choice is usually preferred in the hospital unit during morning rounds during a mock exam? Option A. Collect directly through the 4 tubing without authorization. Option B. Use the opposite arm when available and follow facility policy. Option C. Ignore the 4 because additives prevent contamination. Option D. Draw above the 4 site while fluid is running. The correct answer is option B. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Drawing above a running 4 can contaminate or dilute the specimen. Question 18. For a troponin collection, which finding makes a venipuncture site a poor choice? Option A. Clean intact skin over an antecubital vein. Option B. A site that allows safe patient positioning. Option C. Edema, burns, scarring, or signs of infection at the site. Option D. A vein that is palpable and resilient. The correct answer is option C. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Question 19. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the pediatric clinic during a practice drill? Option A. Successful fasting status. Option B. Normal clot retraction in the vein. Option C. Proper tube mixing. Option D. Hematoma formation. The correct answer is option D. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Question 20. If a hematoma starts to develop during venipuncture, which action is appropriate in the long-term care unit during a scenario? Option A. Release the tourniquet, remove the needle, and apply pressure. Option B. Massage the swollen area vigorously. Option C. Ask the patient to bend the elbow tightly. Option D. Continue filling all ordered tubes. The correct answer is option A. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Question 21. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the mobile collection site during a competency review? Option A. Leave the needle in while getting more tubes. Option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option C. Give the patient food before removing the needle. Option D. Ask the patient to stand up and walk it off. The correct answer is option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Question 22. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the emergency department bay during a final review? Option A. Ask the patient to bend the elbow sharply. Option B. Use the same bandage time for every patient without checking. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Skip pressure to avoid bruising. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Question 23. Before proceeding with the draw, which action helps prevent a hematoma after removing the needle in the physician office lab during a study session? Option A. Rub the puncture site to spread the blood. Option B. Remove the needle before releasing the tourniquet every time. Option C. Have the patient bend the elbow tightly. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Question 24. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the community health screening event during a structured exam prep drill? Option A. Possible arterial puncture. Option B. Tube additive carryover. Option C. Normal capillary refill. Option D. Proper venous flow. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Question 25. In the preoperative testing area, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A. Gray fluoride tube. Option B. Blood culture bottles or sterile culture tube. Option C. Serum separator tube. Option D. Lavender EDTA tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Question 26. In the standard venipuncture order of draw, which tube usually follows blood cultures in the oncology infusion center during a review? Option A. Gray fluoride tube. Option B. Royal blue tube for every test. Option C. Light blue sodium citrate tube. Option D. Lavender EDTA tube. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Question 27. To protect patient safety, which order is most appropriate for collecting blood cultures? Light blue, serum, green, lavender, and gray tubes in the dialysis adjacent clinic during a mock exam? Option A. Gray, lavender, green, serum, light blue, blood cultures. Option B. Serum, lavender, blood cultures, gray, light blue, green. Option C. Lavender, gray, green, serum, light blue, blood cultures. Option D. Blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Question 28. Why does order of draw matter during evacuated tube collection in the student skills lab during a skills check? Option A. It helps prevent additive carryover from altering later specimens. Option B. It eliminates the need to mix tubes. Option C. It determines the patient's fasting status. Option D. It makes patient identification optional. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Question 29. During capillary puncture, which specimen type is generally collected first when ordered in the occupational health clinic during a practice drill? Option A. Gray top microtube. Option B. Blood gas specimen. Option C. Non-additive tube after all others. Option D. Serum specimen.
The correct answer is option A. Gently adjust the needle position while maintaining safety.
Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Question 30. In a routine phlebotomy scenario, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the blood collection station during a scenario? Option A. Gray microtube first even when blood gases are needed. Option B. Any order because capillary tubes have no additives. Option C. EDTA microtube before other additive and serum microtubes. Option D. Serum microtube before EDTA for every draw. The correct answer is option C. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Question 31. Before proceeding with the draw, which tube is most appropriate for a routine CBC in the outpatient clinic during a competency review? Option A. Gray sodium fluoride tube. Option B. Red no additive tube. Option C. Light blue sodium citrate tube. Option D. Lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Question 32. During a final review, which additive is found in a light blue tube used for patient and APTT testing in the hospital unit during morning rounds during a final review? Option A. Sodium citrate. Option B. Sodium fluoride with potassium oxalate. Option C. Lithium heparin. Option D. EDTA.
The correct answer is option B. Surgical removal.
Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Question 33. In the urgent care laboratory, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, light blue citrate tube. Option B, serum separator tube with clot activator and gel. Option C, gray fluoride tube only. Option D, lavender EDTA tube. The correct answer is option B, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Question 34. For a thyroid panel collection, which tube is commonly associated with heparinized plasma chemistry testing? Option A, light blue top tube. Option B, pink top tube. Option C, green top tube. Option D, lavender top tube.
The correct answer is option A, sinoatrial node.
Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Question 35. To protect patient safety, which tube is most commonly used for glucose preservation when testing may be delayed in the long-term care unit during a clinical simulation? Option A, light blue citrate tube. Option B, blood culture bottle. Option C, plain red tube only. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Question 36. After reviewing the order, which tube is commonly used for blood bank testing such as type and screen in the mobile collection site during a review? Option A, pink top EDTA tube. Option B, light blue citrate tube. Option C, green heparin tube for every blood bank test. Option D, gray top fluoride tube. The correct answer is option A, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Question 37. When preparing for collection, which tube is generally collected for a blood culture specimen in the emergency department bay during a mock exam? Option A, gray fluoride tube. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, SST after clotting. Option D, lavender EDTA tube only. The correct answer is option B, sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. Question 38. Why must a light blue citrate tube be filled to the proper level in the physician office lab during a skills check? Option A, EDTA needs extra room to mix. Option B, serum cannot clot unless the tube is full. Option C, the blood to anticoagulant ratio must be correct for coagulation results. Option D, the tube color changes if underfilled.
The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light sensitive specimens. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Question 39. An office review in a busy front office shows that a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Blow on the site to speed drying. Option B. Allow the alcohol to dry completely. Option C. Draw blood while alcohol is still wet. Option D. Touch the vein again with an ungloved finger. The correct answer is option B. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Wet alcohol can sting and may affect specimen quality. Palpating after cleaning can contaminate the site unless proper technique is used. Question 40. After reviewing the situation in a clinical skills review, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Coinsurance posting. Option B. Order of draw. Option C. Sterile field setup. Option D. Matrix blocking. The correct answer is option D. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Coinsurance posting relates to patient financial responsibility. Order of draw guides blood collection sequence. Sterile field setup supports clinical procedures, not schedule blocking. Question 41. When a patient encounter unfolds in a medical office workflow, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Left arm below the clavicle. Option B. Fourth intercostal space at the left sternal border. Option C. Fifth intercostal space at the left midclavicular line. Option D. A fourth intercostal space at the right sternal border. The correct answer is option D. Fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. That location corresponds to V4 in standard placement. Question 42. When a patient encounter unfolds in a diagnostic testing area, a peak flow test is ordered. Which body system is being assessed? Option A. Respiratory system. Option B. Urinary system. Option C. Skeletal system only. Option D. Integumentary system. The correct answer is option A. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 43. In a primary care office, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Wash the area and report the exposure according to protocol. Option B. Hide the incident if there is no bleeding. Option C. Place a bandage on the site and ignore it. Option D. Finish all remaining patients before telling anyone. The correct answer is option A. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. Question 44. While working in a women's health clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Ask respectful questions and avoid judgment. Option B. Refuse to document relevant information. Option C. Tell the patient the practice is foolish. Option D. Assume all people from that culture act the same. The correct answer is option A. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Question 45. An office review in a preventive care visit shows that a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Warm the finger or choose a better perfused site. Option B. Ignore the waveform and record the lowest value. Option C. Increase oxygen without reporting the finding. Option D. Place the probe over wet nail polish. The correct answer is option A. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. Question 46. In a family practice clinic, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right color of vial and right storage shelf. Option B. Right patient, right medication, right dose, right route, right time, and right documentation. Option C. Right diagnosis only. Option D. Right insurance, right copay, right appointment, and right room. The correct answer is option B. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Question 47. For a patient encounter in a cardiology practice, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The pulse oximetry reading will be inaccurate. Option B. The blood pressure may read falsely high. Option C. The blood pressure may read falsely low. Option D. The temperature will be elevated. The correct answer is option B. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Question 48. An office review in a patient intake station shows that a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Sims. Option B. Fowler. Option C. Supine. Option D. A prone. The correct answer is option C. Supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Prone means lying face down. Question 49. To protect safety in a same-day appointment, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The little finger near the bone. Option B. The tip of the index finger. Option C. The side of the middle or ring finger pad. Option D. The center of the thumb pad. The correct answer is option C. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The little finger has less tissue over bone and is usually avoided. The index finger is commonly used for touch and may be more sensitive or calloused. The thumb is often calloused and has a pulse, making it less preferred. Question 50. As part of exam preparation in an administrative check-in area, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Place 2 or 3 fingers over the radial artery at the wrist. Option B. Place the stethoscope over the abdomen. Option C. Count respirations before locating the pulse. Option D. Use the thumb to feel the pulse. The correct answer is option A. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. The thumb has its own pulse and can interfere with accurate counting. Question 51. Following office protocol in a certification exam scenario, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Schedule a routine follow-up for next week. Option B. Ignore the symptoms if the injection site looks clean. Option C. Tell the patient to drive home and rest. Option D. Notify the provider and activate emergency protocol immediately. The correct answer is option D. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Potential anaphylaxis cannot be delayed for routine follow-up. Systemic allergic symptoms matter even if the injection site appears normal. Respiratory symptoms and swelling require immediate attention. Question 52. Before the visit continues in a treatment room, the provider discusses the function of white blood cells. Which role is most accurate? Option A, help defend against infection. Option B, store bile for digestion. Option C, produce insulin in the pancreas. Option D, carry oxygen as their primary job. The correct answer is option A, help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Question 53. For a patient encounter in a specialty referral visit, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A, use expired kits if the package is unopened. Option B, follow manufacturer instructions and quality control policy. Option C, skip controls because waived means unregulated. Option D, report results before the test develops. The correct answer is option B, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 54. To protect safety in a walk-in clinic, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, the fingernail bed. Option B, a reddened rash site. Option C, deltoid muscle when the medication and volume are appropriate. Option D, inside a visible vein. The correct answer is option C, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 55. In a telephone triage workflow, an electronic record uses an audit trail. What is its purpose? Option A, track who accessed or changed information. Option B, measure blood pressure. Option C, sterilize instruments automatically. Option D, approve insurance claims instantly. The correct answer is option A, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 56. At the start of care in an urgent care office, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A, ignore the error even if it affects care. Option B, delete the original note completely. Option C, ask a coworker to change it under their login. Option D, make an addendum according to office policy. The correct answer is option D, make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Deleting a signed record can destroy the audit trail. Using another person's login violates accountability. Question 57. Given the workflow in a medical office workflow, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, Trendelenburg as the only routine choice. Option B, lithotomy position. Option C, Fowler position. Option D, prone position. The correct answer is option C, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Prone places the patient face down and may worsen breathing comfort. Question 58. After reviewing the situation in a diagnostic testing area, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, order random supplies without reviewing use. Option B, wait until every item is completely gone. Option C, track usage and adjust par levels according to office needs. Option D, hide supplies from the provider. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Waiting can interrupt patient care and office workflow. Hiding supplies does not solve inventory management. Question 59. To protect safety in a patient education session, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, lavender EDTA tube for serum. Option B, a red or gold serum tube. Option C, gray fluoride tube for all serum tests. Option D, light blue citrate tube for serum. The correct answer is option B, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. Question 60. Given the workflow in a medical office workflow, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, sugar in the blood. Option B, air in the lungs. Option C, blood in the urine. Option D, protein in the stool. The correct answer is option C, blood in the urine. Hematuria means blood is present in the urine. Sugar in the blood is described by glycemia terms. Air in the lungs is not described by hematuria. Protein in stool is not hematuria. Question 61. Before the visit continues in a busy front office, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, update the preferred pharmacy after verifying the new information. Option B, leave the old pharmacy because it is already in the chart. Option C, delete all pharmacy information from the record. Option D, choose the pharmacy closest to the clinic. The correct answer is option A, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Question 62. Given the workflow in an administrative check-in area, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, place all charts open on the counter. Option B, state the full diagnosis loudly to confirm the visit. Option C, ask other patients to help verify the record. Option D, speak quietly and avoid announcing sensitive details. The correct answer is option D, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Question 63. For a patient encounter in a cardiology practice, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, place a warning sign and arrange cleanup immediately. Option B, ignore it because it is not in an exam room. Option C, cover it with loose papers. Option D, wait until a patient reports slipping. The correct answer is option A, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Prevention should occur before an injury happens. Question 64. A medical assistant is working in a walk-in clinic when a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A, ignore all provider instructions about inhalers. Option B, eat a heavy meal immediately before every test. Option C, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option D, wear tight clothing that restricts breathing. The correct answer is option C, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Question 65. While working in an administrative check-in area, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, excessive thirst. Option B, painful or difficult urination. Option C, ear inflammation. Option D, difficulty swallowing. The correct answer is option B, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Ear inflammation is otitis. Difficulty swallowing is dysphagia. Question 66. As part of exam preparation in a quality control review, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, send the patient home to rest without notifying anyone. Option B, recheck using proper technique and report the finding according to protocol. Option C, tell the patient that hypertension has been diagnosed. Option D, erase the value because it may worry the patient. The correct answer is option B, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Accurate documentation is required even when the value is abnormal. Question 67. An office review in a medical office workflow shows that a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, keep only the first void and discard the rest. Option B, collect urine only when symptoms occur. Option C, discard the first void and collect all urine for the next 24 hours. Option D, leave the container unrefrigerated unless it smells unusual. The correct answer is option C, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Storage requirements should follow the test protocol and preservative instructions. Question 68. Given the workflow in a preventive care visit, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, refuse because records belong only to the provider. Option B, follow the office release of information process. Option C, delete sensitive information before the request is reviewed. Option D, give the record to anyone who asks. The correct answer is option B, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 69. In a telephone triage workflow, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, open the tube and stir with a swab. Option B, leave the tube unmixed until pickup. Option C, gently invert the tube the required number of times. Option D, shake the tube forcefully. The correct answer is option C, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 70. As part of exam preparation in an exam room, a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, prone. Option C, supine. Option D, lithotomy. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 71. A medical assistant is working in a quality control review when a patient needs crutch walking education after provider instruction. Which principle is important? Option A, crutches should fit properly and not press into the axilla. Option B, crutches should be used only on wet floors. Option C, body weight should rest mainly on the armpits. Option D, the patient should skip follow-up if pain increases. The correct answer is option A. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Worsening symptoms should be reported according to instructions. Question 72. As part of exam preparation in a same-day appointment, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Use it after expiration if it looks clear. Option B. Place it in direct sunlight to warm quickly. Option C. Maintain required temperature storage and check expiration before use. Option D. Store it in a desk drawer overnight. The correct answer is option C. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 73. At the start of care in a same-day appointment, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, 4. Option B, PA. Option C, subcut. Option D, IM. The correct answer is option B, PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. IM means intramuscular and refers to injection into muscle. Question 74. As part of exam preparation in an internal medicine office, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Post the complaint online for staff opinions. Option B. Argue until the patient stops complaining. Option C. Listen respectfully and follow the office complaint process. Option D. Delete documentation related to the complaint. The correct answer is option C. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Question 75. During a specialty referral visit, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, copayment. Option B, adjustment. Option C, premium. Option D, deductible. The correct answer is option A, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A premium is the amount paid to maintain insurance coverage. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 76. An office review in a phlebotomy station shows that a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Assist the patient to sit or lie down safely. Option B. Leave the patient standing while searching for forms. Option C. Tell the patient dizziness is impossible. Option D. Ask the patient to walk faster. The correct answer is option A. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. Question 77. To protect safety in an internal medicine office, a patient wants information released to a spouse. Which documentation is usually needed? Option A. No documentation because spouses always have full access. Option B. A verbal request from the spouse only. Option C. A valid authorization or permission according to office policy. Option D. A note written by the assistant after the fact. The correct answer is option C. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Question 78. The care team in a patient intake station asks for guidance because the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, villi. Option B, ureters. Option C, alveoli. Option D, tendons. The correct answer is option C, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Villi increase absorption in the small intestine. Ureters carry urine from the kidneys to the bladder. Tendons connect muscle to bone. Question 79. As part of exam preparation in a women's health clinic, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Open sterile supplies without touching the inner sterile surface. Option B. Place sterile gauze on an unclean counter. Option C. Reach across the field with unsterile clothing. Option D. Reuse sterile gloves from a previous patient. The correct answer is option A. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Reaching over the field can contaminate it. Sterile gloves are single-use and patient-specific. Question 80. As part of exam preparation in a community health clinic, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. Patient states, "I have had a cough for 3 days." Option B. Patient is definitely exaggerating the cough. Option C. No documentation is needed for symptoms. Option D. The assistant diagnoses pneumonia. The correct answer is option A. Patient states, "I have had a cough for 3 days." Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Judgmental wording is inappropriate and not objective. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Question 81. The care team in a patient intake station asks for guidance because a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Routine scheduling. Option B. Breach of confidentiality. Option C. Quality control testing. Option D. Appropriate marketing. The correct answer is option B. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Scheduling does not involve posting private health information publicly. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 82. After reviewing the situation in a cardiology practice, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Use it because the cap is still attached. Option B. Mix it with another vial to avoid waste. Option C. Follow facility policy and do not use it if safety cannot be verified. Option D. Guess the opening date from memory. The correct answer is option C. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Combining vials can contaminate medication and is not appropriate. Guessing creates unsafe documentation. Question 83. The care team in a certification exam scenario asks for guidance because a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A. Count for 10 seconds and multiply by 6. Option B. Skip the pulse and record not available. Option C. Use the patient's previous pulse from the chart. Option D. Count the pulse for a full 60 seconds. The correct answer is option D. Count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Question 84. During a primary care office, a sterile package is torn before a minor procedure. Which action is required? Option A. Consider the contents contaminated and obtain a new sterile package. Option B. Use the items if they look clean. Option C. Tape the wrapper and use the contents. Option D. Spray the package with disinfectant. The correct answer is option A. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Question 85. A medical assistant is working in a same-day appointment when the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Stop and resolve the discrepancy before proceeding with care. Option B. Use the appointment time as the identifier. Option C. Continue if the last name matches. Option D. Correct the date of birth without asking anyone. The correct answer is option A. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Question 86. The care team in a walk-in clinic asks for guidance because the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A. Melatonin. Option B. Thyroxine. Option C. Estrogen. Option D. Insulin. The correct answer is option D. Insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Thyroxine is a thyroid hormone involved in metabolism. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 87. As part of exam preparation in a medical office workflow, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Lithotomy. Option B. Sims. Option C. Prone. Option D. Trendelenburg. The correct answer is option A. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Prone means lying face down and is not the common pelvic exam position. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Question 88. A medical assistant is working in a patient intake station when a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Patient confidentiality. Option B. Prior authorization. Option C. Chain of custody. Option D. Sterile technique. The correct answer is option A. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Prior authorization concerns payer approval for services. Chain of custody concerns specimen handling documentation, not public conversations. Sterile technique concerns preventing contamination during procedures. Question 89. Following office protocol in a preventive care visit, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Verify the allergy information and enter it clearly in the medical record. Option B. Place the form in the chart without reviewing it. Option C. Ask the patient to remember only prescription allergies. Option D. Remove allergies that the patient says happened many years ago. The correct answer is option A. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Question 90. To protect safety in a specialty referral visit, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Reverse isolation for staff protection only. Option B. Contact precautions only. Option C. Airborne precautions. Option D. Droplet precautions only. The correct answer is option C. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Question 91. In a procedure setup, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A. Release it and allow the arm to recover before continuing. Option B. Tighten it further until the vein bulges. Option C, move it over the venipuncture site. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option A. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. More pressure can increase discomfort and alter specimen quality. A tourniquet is placed above the site, not over the puncture area. Tourniquet time can affect certain laboratory values. Question 92. At the start of care in an infection control audit, the term hypertension appears in the problem list. Which meaning is correct? Option A, high blood pressure. Option B, joint inflammation. Option C, low blood glucose. Option D is slow breathing. The correct answer is option A, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Joint inflammation is arthritis. Low blood glucose is hypoglycemia. Slow breathing is bradypnea. Question 93. In a community health clinic, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, only the caller's first name. Option B, a promise that medication will be prescribed. Option C, caller identity, contact information, reason for call, and urgency. Option D, the assistant's guess about the diagnosis. The correct answer is option C, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. A first name alone may not identify the patient or issue. Medication decisions belong to the provider. Diagnosis should not be guessed in a phone message. Question 94. To protect safety in a certification exam scenario, a claim requires the code that explains why a service was performed. Which code set is used? Option A, ICD-10-CM. Option B, place of service only. Option C, NDC only. Option D, CPT. The correct answer is option A, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. Place of service identifies setting, not the medical reason for care. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Question 95. At the start of care in a family practice clinic, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, appendix. Option B, gallbladder. Option C, thyroid gland. Option D, urinary bladder. The correct answer is option C, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. Question 96. During an internal medicine office, a voicemail must be left for a patient according to office policy. Which message is safest? Option A, leave limited information and a callback number. Option B, describe the diagnosis in detail on the message. Option C, demand payment details with full medical history. Option D, leave another patient's results for comparison. The correct answer is option A, leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Detailed clinical information may be heard by unauthorized people. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Question 97. The care team in a treatment room asks for guidance because a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, notify the provider or designated clinical staff promptly. Option B, discard the result because it is abnormal. Option C, tell the patient the exact diagnosis without provider review. Option D, file the result for review at the end of the month. The correct answer is option A, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Question 98. At the start of care in an internal medicine office, a patient falls in the exam room. Which action is best? Option A, call for help and assess for injury before moving the patient. Option B, pull the patient up immediately. Option C, hide the incident if no one saw it. Option D, tell the patient to drive home without evaluation. The correct answer is option A. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Moving the patient before assessment can worsen an injury. Falls must be reported and documented according to policy. The patient should be assessed before leaving. Question 99. After reviewing the situation in a patient education session, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, use the same gloves to clean the next room. Option B, perform hand hygiene. Option C, apply lotion instead of cleaning hands. Option D, place the gloves in a regular drawer. The correct answer is option B, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Gloves are task-specific and should not be reused between patients or areas. Lotion does not replace hand hygiene. Used gloves are contaminated waste and should be discarded properly. Question 100. In a same-day appointment, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, puncture through visible dirt. Option B, skip patient identification because the test is quick. Option C, use the first visibly dirty drop for every test. Option D, clean and dry the puncture site according to protocol. The correct answer is option D, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Site contaminants can affect the first drop depending on protocol.